very good evening all. I'm Aditi Lama with the Tuesday night edition of South Asian News. Vision of Asia, we are coming to you from our studio in New York City. Welcome to the show. Let's begin by taking a look at the coronavirus pandemic and its impact. Globally, we are looking at more than 95.7 million cases of COVID-19 with more than 2 million deaths. In the United States, we are at 24.1 million coronavirus cases with now 400,000 deaths. Quite a grim milestone. This evening, the president-elect honored lives lost to COVID-19 in a nationwide memorial lighting service at the Lincoln Memorial Center, which saw a reflecting pool with 400 lights. Hospitals are overwhelmed across the nation, especially in states such as California, Arizona, Georgia, and others, where many have had to resort to treating patients in hallways and ambulances with hospitalization capacity in ICU beds, emergency room, and more. Experts are urging Americans to not put their guard down and continue following CDC guidelines of washing hands, social distancing, and wearing a mask. On vaccine, the rollout so far has seen more than 31 million vaccine doses distributed to the states, with more than 10.5 million inoculated with the first dose of COVID-19 vaccine. More on the coronavirus, President Trump yesterday lifted COVID-19 travel restrictions for Europe and Brazil effective January 26. However, the incoming Biden-Harris administration has said that they plan to block the executive order. In politics, today is the last day of President Donald Trump's presidency as the nation prepares for President-elect Joe Biden's inauguration ceremony tomorrow, January 20th. On inauguration, Washington, D.C. and states across the country have heightened security due to threats on Inauguration Day coming in since the U.S. Capitol attack by pro-Trump mob 2 weeks ago. The nation tomorrow will see a new president who has made COVID-19 economic health recovery his priority for the first 100 days. Much is happening in the nation, so we have tonight several local officials, community leaders, commentators, and healthcare professionals. Here are the headlines. Dr. Tushar Patel on surging coronavirus cases and vaccine rollout, New Jersey. Dr. Neeta Jain on fair recovery and activism, candidate for New York City Council District 24th, Queens, New York. Common Cause New York hosts virtual forum, ranked choice voting, and race for City Council District 24th, New York City. And it's time for a short break on Vision of Asia South Asian News segment. We'll be right back. Welcome again. I am Aditi Lama and this is Vision of Asia, Tuesday night episode of South Asian News. Let's take a look at coronavirus pandemic's measures and updates. The nation has surpassed 400,000 deaths as cases continue to surge all across the states, even with the arrival of COVID-19 vaccine. This number of 400,000 deaths has been recorded in less than a year, while infections have continued to mount across the country. We have lost more Americans than the World War I, the Vietnam War, and the Korean War combined, and nearly as many Americans who died in World War II. More than 60% of COVID-19's 24 million cases in the country have been reported since November's election day. Yesterday, more than 123 COVID-19 patients were reported to be in hospitals, where many are reaching capacity and running out of intensive care units. Also, the country has been averaging more than 200,000 new daily in the past 7 days. Meanwhile, the vaccine rollout continues to be slow and without any national strategy to effectively give out vaccines. Out of 31 million doses, only 12 million doses have been administered. The new incoming Biden administration aims to vaccinate 100 million people in the first 100 days. The president-elect has proposed a $1.9 trillion pandemic relief package that includes $70 billion for virus testing and a national vaccination program. More on vaccine rollout and surge in cases, we have now our conversation with expert Dr. Tushar Patel. Urging all to remain vigilant and follow CDC guidelines, here is Dr. Patel. Let's start by looking at some numbers that are coming in today as of Monday. In the United States, we have surpassed 24 million cases of COVID-19. We're at 398,000 deaths. It's approaching 400,000 very soon. Globally, we are looking at 95.2 million cases and deaths have surpassed 2 million. My question to you is, could you describe to me what is happening at these overwhelmed hospitals and why are they not able to contain this virus right now?
So we discussed this before. United States has no national healthcare plan to respond to the pandemic. And we have been struggling for almost a year now since late January. we don't have the message for our people, consistent message to mitigate, to control the virus. There is no guideline. There is a guideline, but each state is following their own guidelines. So I think those are the multiple factors in this increase, plus the Thanksgiving holidays, Christmas holidays, New Year. I think all the traveling also accumulating the new cases. And we are right now in the darkest days of this pandemic right now.
How was your experience getting it and what vaccine you got? And then we'll go more explanation into what's happening with the vaccine rollout.
So the original plan to have 20 million people vaccinated, 40 million doses by end of December. Right now, as of today, we had distributed 31 million doses and administered between 10 and 14 million people. So that's only 5% of the total population. There are 2 doses, only 1.6 million people received the vaccination so far. The good news is for last few days, we have close to 900,000 doses given every single day. So that is a good news. But the production, the ramping up, the rollout, all needs to be well coordinated between the federal and the state governments.
That's for sure. What vaccine did you receive, Dr. Patel?
I did not receive it yet. I'm still on the waiting list to get the vaccine, and I'm hoping to get that within next couple of weeks due to my status of phase 1B. I should be getting that within next few weeks. But there is a huge challenge of the vaccine distribution because there should be a national plan, and the ramping up, the production, the rollout, the distribution, all has to be well coordinated. And if we don't have that, there are a lot of people who wants to take the vaccination, rightfully so, but they don't have access right now. And that is the sad part.
How are you looking at Moderna and Pfizer right now? I've been asking doctors this question. Do you see a big difference between which vaccine we should receive? And also, following that, I'd like to know your take on what's happening with AstraZeneca and Johnson & Johnson.
So let's talk about the Pfizer and the Moderna vaccine. There should not be any preference. Whoever is getting the vaccine and whatever is provided to them, they should be taking that. Both vaccines are similarly effective. Sometimes the immune response from the individual can cause the local reaction, the mild fever, body ache. Those are the normal symptoms, and nobody should be discouraged from those. The vaccination coming in the pipeline, J&J is on their 3rd phase of trial right now, and hopefully they will submit the emergency authorization by early February.
Yes, for sure. AstraZeneca has been approved in India, but I don't know if it has been approved in the United States. Any insight into what's happening there?
So AstraZeneca's right now, nowhere in the near future, they will be finishing the phase 3 trial for the US. I think the criteria for the safety and efficacy for the CDC and the FDA, they do not follow their guidelines, and they don't have that in place at this time. Compared to J&J, they do have that in place. They are already enrolled 45,000 people, and hopefully they will be finishing the phase 3 trial by end of this month. So I think I see J&J, Johnson & Johnson vaccine first, then the AstraZeneca.
But why has that then been approved in different countries, Dr. Patel?
I think United States has a different set of criteria for the safety and efficacy and approval, and I think that could be the reason. I think their data shows less than 70% safety and efficacy. It could be that. It could be they haven't finished the entire study for the US population.
You know, looking more at our motherland real quick, India has started its vaccination process too. AstraZeneca is one of the vaccines they're giving, but they're also giving this vaccine called Bharat Biotech. It's something that has been produced there. Any insight into that?
I think anything approved in India is also clinically efficacious and safety wise is already weighted by their scientists and by the regulations. I would not discourage anyone to challenge that. I think India also has a wonderful system of control of the vaccination, and all I can request that whenever they have the vaccine available to them, without question, they should take the vaccine. The mild side effects are already a good sign to have. So I would not discourage anyone to challenge any vaccination coming to them whenever they get the vaccine.
Let's now take a look at the special election for New York City Council in District 24th of Queens on February 2nd. First of its kind, this election features ranked choice voting, where the voters get to rank their top 5 candidates in order of preference. We have tonight a conversation with Dr. Neeta Jain, candidate for City Council in New York's District 24th. With the city struggling under pandemic, recession, and politics, Dr. Neeta Jain aims to bring a fair recovery with progressive activism and leadership. Dr. Jain is an Indian-American psychologist, a Democratic district leader, elected DNC delegate for Biden-Harris, an educator, and founder and president of the International Ahimsa Foundation. Bringing 30 years of experience in the field of medicine and politics, Dr. Neeta Jain hopes to uplift vulnerable communities with access and resources for good health, education, small businesses, safety, and affordable housing. Her approach is putting community first, and she hopes to be the voice for South Asian Americans. Here is our conversation with Dr. Neeta Jain, candidate for New York City Council, District 24th of Queens. So let's talk about the diversity of District 24, Dr. Jain. Tell me about the South Asian influence you see in the district. How large is the population? And, when you're looking at the diversity of this district, what kind of communities reside there?
This is I believe this is the most diverse district in my whole, Queens County. We have all different ethnic groups live in this district. As you know, even within South Asian, we have a lot of different. We have Pakistani, we have Bangladeshi, we have Nepali, we have Indian, right? All 4 definitely are there, and we are growing day by day. We have Jewish community, we have Hispanic community, we have African American community, we have Korean Chinese community. So we have all mixed. But right now, I can tell you that immigrant community overall is increasing in this district. People are moving into this district a lot, and we have seen a lot of changes from 10 years back in this community. Community has changed, the people has changed, the races have changed, and so the needs are changed.
For sure. Let's just talk about these needs and discuss a little bit more on District 24th. I'd like to talk to you about the economic as well as healthcare ramifications of COVID-19 that you've seen in District 24th. New York was one of the hardest hit cities in the beginning of the pandemic, and we're still taking the burden off it. How bad was it for the communities in District 24th?
It was very bad, and I'm sure you have heard even in in the beginning of the pandemic, Kew Garden Hills was very badly hit.
Right.
Pamnak was very badly hit. I'm just coming back from Pamnak, and I know why. And overall, this whole district, Fresh Meadow was very badly hit, and we didn't hear that much in Briarwood, but Richmond Hill also touches our district. Jamaica also is a part of our district. So overall, we can say that the overall district, overall Queens County got very badly hit. But we have these 2 communities they were really suffered a lot in the beginning of the pandemic. Now they got a little better. Now again, the surge is there, and people are getting more and more sick. So I just want to tell at this point right now, please be careful, please stay safe, please use mask. I was out there in my district, and I would say out of 10 people, only I'd say 7 people were not wearing masks. And I was doing mask distribution, and I said, please wear mask. It keeps you safe and other people as well safe.
Right.
There's a lot of need for education also on the health point of view. As I am a professional mental health person, I'm a professional health person, and I know that we have a long way to go on that personal ground. The healthcare, small businesses, what you just said, the economically, a lot of businesses are out. When I go out, I see shutters are down. people are not there. And some people, small businesses who came back to their doors, they are still suffering. They are like single person, owned business. They did not get SBA loans in the beginning, right? Because they have no employees to show, they have no payroll to show. So there are people who really needs help, and I'm trying to help them as much as I can. I even told them that, after this 2nd February, I will bring professionals to help you, sit down with you and do the paperwork and whatever guidance you need. Education in every field right now, education is the most important part. When you say for the healthcare, when you say for the mental health, when you say for the small businesses, everywhere you need an education to tell people how to go forward.
It's time for the short break on Vision of Asia, Voice of the Community. We'll be back shortly. And welcome back. I am Aditi Lama, and this is Vision of Asia South Asian News segment. We have now another segment of the virtual forum organized by Common Cause New York on ranked choice voting and the race for city council in New York City's District 24th in Queens. The virtual event was co-sponsored by Rank the Vote New York City, the Queens Daily Eagle, Disability Rights New York, and the Northeastern Queens chapter of the civil rights organization NAACP, the National Association of Advancement of Colored People. Common Cause fights for accountable government, equal rights, opportunities, and representation, and empowers voices to be heard. With that, the virtual forum saw a discussion on the importance of ranked choice voting for the New York City Council seat in District 24th, Queens, and featured candidates running for the council seat along with other organizations, community leaders, and officials in support. ITV Gold was proud to be a part of the virtual forum, which brought together thought-provoking conversations on several issues. The candidates who participated were Momita Ahmed, Deepthi Sharma, Dilip Nath, Soma Saeed, James Gennaro, and Dr. Neeta Jain.
Begin this. A very good evening, all. My name is Aditi Lamba, and I'm a TV anchor and a content producer at ITV Gold, based out of Astoria, New York. I host a daily show, a South Asian news segment called Vision of Asia. ITV Gold is the longest serving South Asian network in this nation, and we proudly represent the community voice through a variety of issues dealing with politics, medicine, culture, and much more. During this pandemic, we have continued to bring thought-provoking and knowledgeable news featuring elected officials, doctors, community activists, organizers, and many more. I'm super excited to be here at the forum today, and we hope that we are able to really promote ranked choice voting through this. Now I'd like to introduce my co-moderator for this evening, David Brand from the Queens Daily Eagle.
Thank you, Aditi. My name is David Brand. I'm editor of the Queens Daily Eagle. We are Queens' only daily English language print paper, and you can find us at queenseagle.com. Follow us on Facebook and Twitter at Queens Eagle. I'm also the co-host of a weekly Sunday morning live news show on WBAI 99.5 FM called City Watch, which I host with my friend and partner Jeff Simmons, who is also from Queens. So this show definitely has a distinctive Queens flavor to it. So I encourage you to tune in every Sunday, 10 a.m. on 99.5 FM. Really excited to be participating in this forum. Kind of a historic moment. It's our first test of ranked choice voting. And so it's cool that it's happening in Queens. Thank you, Common Cause, for inviting us to participate.
I think that we have to make sure that we're talking about workers' rights, and that includes sex workers. And we need to make sure, right, that we pass laws, right, that are protecting all of our workers. And we also I feel like one other issue that's taboo, but we need to address, because this is the issue, top priority right now, is making sure people, especially homeless people, have a place in our communities, in our societies. Because you know what? We're closer to being homeless than becoming billionaires right now. And we need to address the homelessness situation and make sure we invest in our shelters and give these people the opportunities to come back to our society to get relief. And I think those are often taboo issues because we're talking about working class Black and brown folks, and it shouldn't be. And that's why ranked choice voting is so great, because it allows candidates like myself who come from working class families. My mom was a fast food worker. My dad, who lost her job during the pandemic. My dad worked overtime as a factory worker, packaging medicine every day, doing graveyard shifts. Like, these are working class people. And without ranked choice voting, I wouldn't have a platform to talk about working class issues, talk about how our workers are facing harassment in the workplace, or that tenants are being harassed by real estate developers, and many of the people that live as renters, right, and work low-wage jobs are Black and brown, and people who are impacted by policies that are excluding workers like sex workers, right, LGBTQ folks, transgender workers, and homeless people, and also people who are, who went to jail and are felons. Like, we need to take care of everyone during this pandemic.
David, Common Cause, and of course our friend Aditi for hosting this event this evening. Look, Queens is the most diverse borough, and I'm excited to see that ranked choice voting taking place first here in New York City at the borough of Queens, and here in the District 24. We speak 190 different languages from 200 different countries, and what other better place to have a ranked choice than here in the borough? Let's go back for a second, right? Before even the ranked choice, we had something called term limit. Term limit was introduced so that we have a new leadership can come into the lead the city, lead the borough. There is also diversity, and then of course now we have ranked choice voting that will further enhance the concept of diversity and inclusion in the diverse borough that we live in. So I'm very excited that is happening here in the Queens. I'm excited that it's happening in the District 24. Yes, as you have mentioned, District 24 have all the nationality that you can think of. It is the melting pot of this city, and the idea is, what matters to you, what matters to Jewish, what matters to South Asian or Latino is mattered to me. Safe street, a good education for our children, easy access to our healthcare. What we have seen during the pandemic, it has devastated our senior, destroyed our economy. And I am running for city council so that we can bring a real solution, a pragmatic solution post-COVID, because we cannot continue the way this city has been leading.
Thank you, Mr. Knapp.
David and Aditi, thank you for moderating. I also like to thank Rank the Vote NYC, NAACP NEQ, Queens Daily Eagle, Disability Rights New York, and Common Cause New York for hosting this. I am a practicing attorney. I grew up in Jamaica, and I've been serving this community for the last 20 years. Because of my business connection as a small business owner, my bar association connections within the legal community as the president of the Queens County Women's Bar Association, and my community work that I've been doing. And every community means great deal to me, because the issues that affect us, they're all same issues. Right now, what's affecting us is the unemployment or underemployment. Education is affecting all of us. And a small business reliefs and assistance, we're not getting enough. So these are issues affecting every community. And my connections with each and every community is very close, whether it be the Black community, Hispanic community, all the Asian community, Jewish, and the white community, because we are all together in one community. We're all looking to better our lives and the lives of our future, our children. So my approach, I am so excited to be running in this time, because we need leadership that is of the future, not of the past. We need leadership that counts everyone. We need leadership that brings everyone to the table. And that's what I plan on doing, because that's what I've been doing for the last 20 years. Thank you.
Well, this wraps up our show for the night. Remember to send us your suggestions and get your voices and organization on our show. Email us on events@itvgold.com or follow us on Facebook at ITV Gold. You can also subscribe to our YouTube channel for free access to many of our popular shows. Thank you for joining us tonight from Queens, New York. This is Vision of Asia, and I am Aditi Lamba. Take care and be well.